So first of all, we're going to take a look at systems theory and its implications for the NHS and healthcare systems in general. As you've read above, systems theory has been around for quite some time, but only just started being related to healthcare. And in this presentation, we're going to take a look at what systems theory is and how we can relate that to healthcare. So what is systems theory? Systems theory is many small organised activities that happen with industry or healthcare that aim to add value to the overall system. These activities work individually, and so we can say that each activity is actually a process. And these small processes going on add to the overall system and the overall working of the system. But the important thing to recognise is that each one of these small cogs or activities, an error can occur. And at this point, using the Swiss cheese model or thinking about cogs in a system, if one cog isn't working, generally that leads to other failures as well. And we can say that the failures in each of these activities generally lead to errors being made. We can divide systems theory up into two categories, and that's social and technical systems. Let's take a look at these in a little bit more detail so we can understand them. The social system is the pattern network of relationships and the formal structure of role that can form the stable group. And I'm sure you can appreciate in healthcare, there's a clear defined hierarchy, whether that's right or wrong, in the relationships and the formal structure that we follow within healthcare. As we've got bands, we go from band 5 to 8A and above, and band 9, and consultants work from F1, F2, right up the way to consultants. In this formal structure and social system, the idea is that the activity within that enables the overall running of the system of the NHS and the healthcare. But within that as well, you've also got the relationship between the staff and the patients, and this is also part of the social system, in that you can sometimes have failings with even staff or patients that can cause error to happen. The second aspect is the technical system, and this is the person, the item or the procedure that forms the function. We can think of each person within the NHS as an activity, and these activities sometimes don't quite work as intended, make errors, which can cause subsequent errors within these and the overall failing of the system. Items can also fail as well in interventions that you're using, in terms of CT scanners breaking down, MRI scanners not working, or services not being available. And also it's procedures as well that don't quite work as well. Sometimes referral procedures are overcomplicated, and sometimes it doesn't perform the function that it should. And at each point these activities can fail and hinder the system, and sometimes this can even cause an error to be made. There's different classifications within systems theory, and healthcare is definitely a complex one. And we classify this as a socio-technical system because it contains aspects of both the social and technical systems that we talked about previously. To summarise the NHS, it contains things like hardware and the computers that we use and the items that we use to perform procedures. It also contains software running in the background in terms of referral processes, computer systems to bring up blood results, scans and x-rays. But it also encompasses things from personal perspectives of staff and patients, and it also encompasses a sense of community as well within the staffs and patients and team working. Each of these, especially the hardware and the software, we can relate to the technical systems, and the personal and community we can relate to the social systems. In thinking about the NHS, it uses aspects of both to varying degrees depending on what's happening in that particular time, procedure or patient encounter. But it is definitely using aspects of both technical and the social system.